What is conservative care? What is that concept?
So conservative care, a lot of patients who come to my clinic have been referred because either someone felt that they needed surgery or they've been referred to sort of figure out their spine difficulties. Conservative care consists of physical therapy, oftentimes injection therapy. Well, I'll refer patients to Dr. Mena and he'll look at these patients. Or sometimes just Tylenol, lifestyle modifications, and other ergonomic changes that they're going to make in their lives. And oftentimes that does work and people's pain does resolve.
And that's actually the best case scenario, right,
That's
Doctor?
correct. That's correct. Most of the patient, the first line of treatment will be, as she said, conservative care, unless the patient, they present what we call red flags. They have weakness, sudden onset of bowel bladder problems, sexual dysfunction. Those are things that we're probably into getting a surgical consultation right away, sooner rather than later. But for the most part, 90+% of patients, most of the time, they will start with that conservative care, and most of the time, they will get better.
When treatments like physical therapy and pain medication is not enough, like we've tried everything at this point, when do you start considering injections, Dr. Mena?
Normally, I will start considering injections whenever there's two things. The most common one will be when patients, they come and we try conservative care, non-steroidal anti-inflammatory medication, sophisticated Aleve or Advils. We send them back to physical therapy. When they come back, they didn't progress at all. They have some mild improvement and they got stuck, they plateau. That's when we start considering the possibility of injection. Keeping in mind, I tell the patient the injection is not a cure. What the injection does is just to relieve some of your symptoms so you can proactively continue doing the exercise program. The second role of the injection will be for people that we know that they're in significant amount of pain, that they are unable to start a physical therapy program, which is not the majority of patients, it's just a very small subset of patients. Sometimes we need to throw an injection prior to get them some relief in order to start them on a physical therapy program. So for the most part, is the first one that I address first. Normally that's the most common scenario that we encounter on a daily basis in practice.